COVID-19 vaccine hesitancy is an issue across the country right now and here at home. Experts say some of the people who worry the most are pregnant women.
The CDC says they should get the vaccine. News 8's Allie Peters joins us now. Allie, you spoke with a local doctor about the COVID vaccine and fertility. What did we learn?
Yeah, just hop online and you can see just how many people are expressing concerns about pregnancy and fertility and getting the COVID-19 vaccine. But scientists and the CDC have said pregnant women should get the shot. So where are those concerns coming from, and what do expecting mothers need to know? Even though thousands of pregnant women have gotten their COVID vaccine, concerns are still high. Yet scientists say it's safe for pregnant women to get vaccinated, especially when the alternative could be catching COVID.
People who are pregnant who get COVID are at increased risk of getting the severe kinds, of being hospitalized, of having severe complications. Whereas the COVID vaccine in over 10,000 people who've gotten it has not shown increased risk in pregnancy.
And although the COVID vaccine is new, experts say it's similar to other shots with positive data.
They are very similar to, in the way that they work, the tetanus shot and the flu shot, and both of those protect and have been well studied in pregnancy with no risk. So I think that's why we feel confident that it's appropriate to tell pregnant people that it's safe and effective to take the COVID vaccine in pregnancy, knowing again that the risk of COVID in pregnancy is so much higher.
Doctors say there can actually be benefits of getting the vaccine during pregnancy.
The antibodies, not the virus, the antibodies cross the placenta and give what we call passive immunity to the baby. So the baby will be born with some circulating antibody in its blood. And that allows, if they were to get exposed, them to passively resist the virus without themselves having been vaccinated or themselves having been exposed.
And when it comes to concerns with infertility, doctors say you don't need to worry.
When we think about COVID vaccine, there really is no evidence that it's going to cause fertility issues. And all of the national societies that have looked at this in detail have really found no evidence at all that the COVID vaccine can affect fertility or would affect fertility.
And as for when a pregnant woman should get the vaccine, Dr. Thornburg says they recommend the second trimester because if you do get minimal side effects, it's better to get them in your second trimester than your first. Live in studio, Allie Peters, News 8.
Allie, thank you. Doctors also recommend, as with anything during pregnancy, you speak with your doctor before you get the vaccine. If you want to learn more about this, you can do so by going over to rochesterfirst.com. We have lots of resources, including a whole section dedicated to the coronavirus.